Each year, thousands of hospital patients develop pressure ulcers. An average pressure ulcer takes 116 days to heal and costs about $10,000 to manage, more than doubling the duration of hospital stay. Yet many studies show that pressure ulcers are largely preventable. Regular repositioning is a proven method for preventing pressure ulcers, but it may be difficult to implement due to staff shortage or risk of staff injury. That's why we created SideLyer, a new repositioning system designed to reduce injuries in immobile patients and their caregivers. SideLyer offers multiple motorized repositioning options instead of manual transfers. Its integrated electric lift allows 3 options for weight redistribution without a need to move patients: vertical movement, angled elevation, and rotational adjustment. SideLyer helps to offload pressure from vulnerable areas, reducing incidence of pressure ulcers by a factor of 10 for immobile patients. Health isn't just physical, it's also emotional. SideLyer fosters meaningful social connection by keeping patients elevated, allowing natural eye contact with caregivers. This commitment to human-centered care extends to your team. SideLyer doesn't protect just patients. It protects your most valuable resource, your staff. By reducing manual repositioning, SideLyer helps protect caregivers from strain and injuries. Patient handling injuries are among the most expensive types of nurse injury, on average costing $15,000 per injury claim. SideLyer is easy to use and clean and does not have disposable parts. It is narrow and maneuverable, making it an excellent repositioning aid for any setting that has immobile patients. Transform your approach to pressure injury prevention. Visit SideLyer.com to schedule a live demo today.
Basically assists healthcare providers to safely and effectively reposition clients. Its primary purpose is to prevent pressure ulcers and pressure injuries.
The SideLyer allows them to have another position where they can have a table where they have a flat surface and they can look at activity or utilize a piece of equipment and still be able to be positioned out of their wheelchair, and so their skin gets a break.
So high, right? Causing strains, causing pain to get them up into the inclined state. SideLyer's already at a flat state.
The looks that I would get, their jaws would drop and they would go, "Oh my gosh, I've never seen one of these things before." And I would tell them, "It's because we made it."
Our reason for being is to be advocates for the individuals we serve. You know, we are their voice because they are the most visible element of our society. They are, and so that's our reason for being.
Welcome, and thank you for your purchase of the SideLyer motorized medical repositioning device. In this video, we'll guide you through the setup, operation, and maintenance of your SideLyer. Whether you're a caregiver in a clinical setting or at home, this step-by-step guide will help you use the SideLyer safely and efficiently. Now, the SideLyer is designed to assist caregivers in repositioning individuals who are bed or wheelchair bound. It's suitable for use with adult and pediatric users that are within the weight capacity. SideLyer provides motorized adjustments to reduce caregiver strain while ensuring user comfort and safety. Before using the device, make sure to read the user manual thoroughly, watch this entire video, and follow all safety precautions. I want to first discuss some safety precautions with you before using the SideLyer. Ensure the device is placed on a flat, stable surface. Always secure the user with the safety harness. Do not exceed the 400-pound weight capacity. The device should only be operated by trained caregivers or medical personnel. Never leave a patient unattended while the device is in use. and do not use this device for purposes other than its intended use. Additional safety information can be found in the user guide, so be sure to have read and understand these important measures before using SideLier. The SideLier consists of three main components: base and backrest frames with cushions and footrest, cabinet and controls, and legs and wheel system. Each section is designed to enhance functionality and safety. Let's go over them in detail. Base and backrest frames with cushions. The backrest cushion and frame supports the user's back and allows for smooth adjustments during repositioning. The base cushion and frame serves as the main resting surface, designed for stability and comfort. The footrest is adjustable to support the user's feet with a weight limit of 40 pounds. It should not be used for standing or extra weight bearing. Next is the cabinet and controls. The cabinet housing contains the motor, battery compartment, and electronic control systems. The user control panel or full access controller is located on the cabinet, allowing caregivers to control all device movements. The remote control provides an intuitive interface for caregivers to operate the device with ease. It features identical control symbols as the main panel for consistency. The USB charging ports are located on the cabinet to charge mobile devices. Then there's the battery level indicator. The green light indicates the battery is above 30%, the red light indicates it's below 30% and requires recharging. If the battery reaches 0%, the tilt mechanism locks until it's recharged. On-off switch powers the device. Turn this on to check the charging status. Legs and wheel system. Each wheel rotates independently for smooth maneuvering. Locking casters ensure stability when the device is stationary. The extended legs prevent tipping and ensure weight distribution remains even. They must be used whenever the SideLier is occupied. Additional components and accessories. There are some additional components and accessories to be aware of, including the IV pole. It's a detachable pole for securely hanging IV fluids or medications. The bedside tray. This provides a convenient surface for the user or caregiver. The power adapter and cradle is used for safe charging and storage of the device's power brick. And the harness, also known as the strap pad. This is essential to secure the user at all times. In this section, we will explore the additional features of the SideLier that enhance user comfort, functionality, and ease of operation. These features ensure that the device is adaptable to various user needs. 1. Adjusting the footplate. The footplate can be lowered or raised depending on the user's height and comfort. To lower the footplate, press the hinge tabs inward and gently guide the plate downward. To raise the footplate, lift it back into position until it clicks into place. Ensure the footplate is securely positioned before use. 2. Adjusting the backrest angle. The backrest can be slightly reclined for additional comfort. To adjust, pull the tabs located on the adjustable hinges outward. Set the backrest at the desired angle and release the tabs to lock it in place. Confirm that the backrest is secure before positioning the user. 3. Using the IV pole. The SideLier includes a detachable IV pole for medical needs. Insert the IV pole into one of the 2 designated slots at the head of the base frame. Ensure the pole is firmly in place before attaching IV equipment. Remove the IV pole when not in use for safety and storage. 4. Remote control storage. The remote control can be stored in the designated cradle when not in use. Attach the remote cradle to the front of the cabinet using screws. Keeping the remote stored properly prevents misplacement and damage. 5. Charging the SideLier. Locate the charging port on the cabinet and connect the power adapter. Plug the adapter into a standard wall outlet. Avoid overcharging by disconnecting once the battery reaches 100%, and never operate the device while it is charging to prevent electrical hazards. 6. Engaging the leg stabilizers. The leg stabilizers enhance stability and should always be extended when the side liar is in use. To extend, loosen the side leg knob to engage the leg stabilizer. Remove the locking pin. Pull the leg outward and rotate into the downward position until it touches the floor. Tighten the side leg knob to secure it in place. Reinsert the locking pin for additional security. Retract the stabilizers and rotate into the upward position when moving or storing the device. Now let's explore how to operate the side liar. First, make sure the side liar is in a position where the power cord can be easily connected and disconnected. 1. Strapping the patient in. Position the user comfortably on the side liar. Place the padded strap across the torso and guide the straps through the space between the base and backrest frames. Wrap the straps around the backrest, secure the clasps, and tighten for a snug but comfortable fit. 2. Securing the patient. Ensure the user is centered on the base cushion. Adjust the backrest and footrest as needed for comfort. Then double-check that all straps are properly fastened before operation. 3. Moving the side liar. Unlock the wheel locks before attempting to move it. Always use the handlebars to push or pull. Be sure to move at a controlled pace and relock the wheels when stationary. Using the control panel and remote control. You can use the control panel or remote for easy positioning. Adjust the tilt, headrest, and base height as needed. Just press the reset button to return the device to a neutral position. Charging the side liar. To charge the unit, connect the power brick adapter to the charging port on the device. Connect the other end to a standard wall outlet. Do not use the device while charging and avoid overcharging. By following these steps, you can ensure safe and efficient use of the side liar. In the next section, we'll cover maintenance and troubleshooting. Routine maintenance keeps your side liar in top condition. Please follow these guidelines. Daily, inspect for visible damage and test the wheel system. Weekly, clean the device, especially patient contact areas with a disinfectant. Monthly, tighten screws, inspect battery life, and ensure all controls function properly. Cleaning, use a soft cloth with mild detergent. Remove cushions before cleaning. Avoid excess moisture near electrical components. If liquid is spilled on or around the product, disconnect the device from the power supply before cleaning. Dry all surfaces thoroughly before turning it back on and using it again. If you experience any issues, try these quick fixes. Device won't charge. If your device won't charge, ensure the power adapter is securely connected and check the outlet. Remote unresponsive? If the remote is unresponsive, replace the batteries or check for obstructions between the remote and receiver. Device difficult to move? If the device is difficult to move, check if the wheels are locked or if debris is blocking movement. Side liar not tilting properly. If the side liar isn't tilting properly, ensure the battery is charged and that no objects are obstructing movement. Additional information about your side liar unit, such as technical specifications, repositioning controls, replacement, and warranty information, can all be found in the user guide. For further assistance, contact Side Liar Technical Support at 407-640-7722 or visit sideliar.com. The side liar is a powerful tool that enhances user mobility and caregiver efficiency. By following these steps, you can ensure a smooth and safe experience. Thank you for watching, and be sure to consult your user manual for more details.